So today we are going to talk about the symptoms of lung diseases. So basically, every system means our body systems like nervous system, digestive system, urinary system. Okay, every system have their organs. Already we studied from the larynx to the alveoli or upper respiratory system from the nose to the trachea. Okay, so basically every system have their own symptoms whenever a disease attacked on the symptom or on the system. Okay, so the system will represent you some type of symptoms which we have to observe. Okay, so what are the symptoms whenever uh, a problem, a disease, any issue occur to the pulmonary system? Okay, so let's discuss about the symptoms of respiratory system. RS, respiratory system. Main symptom or most common symptoms we will discuss here when the patient is telling us, so we can easily identify that is this disease belongs to respiratory system. Okay, so first initially you have to treat the respiratory system. So the most two important symptoms we will observe in every type of respiratory systems or most of the respiratory system if not treated. One is cough, one is cough, and second one is dyspnea. What is name? Dyspnea. We also call is SOB, shortness of breath. Okay. First symptom is cough and second symptom is dyspnea. Dyspnea we will call is difficulty in breathing or shortness of breath. Okay. Here in this dyspnea, it may be due to the two things. One is from the lungs or from the heart. Okay. So we have to differentiate, okay, both those things. It is maybe due to the lungs or due to the heart. So here, most of the time it is lungs, sometimes it's mostly heart. Okay, the first is cough and second is dyspnea. So today we will talk only about uh, this type of symptoms only. Okay, because we have to understand the pulmonary system diseases. Because if we don't know the symptoms, we are unable to treat the patient. And the third is wheezing sound. If we check the lung sounds, because we are inhaling and we are exhaling the air, okay, the gases. So basically, this inhaling, exhaling will cause you some type of sounds. What it will cause? It will cause some types of sounds. So if the sound is normal, you will not get the wheezing sound. Wheezing is a whistle like sound. Okay, whistle like sound. Okay, this is also will observe. Next is, and the fourth thing, we have the stridor. We'll call stridor. It is also one of the common symptom in the lung diseases. Okay, this is also like someone is rubbing you with the nails. Okay, like crowing sound. Okay, okay. So if you are itching, okay, if someone to the wall, or rough surface, if when someone is with their nails or with any hard substance they are rubbing, that type of sound will known as stridor or crowing sound. Okay, and this is the fourth symptom. And the fifth symptom is when the patient or any person is coughing. Okay, coughing, the patient will have blood in the cough or blood in the sputum. This is also indicates lung diseases. Why this happening? We will discuss that thing also. Cough in the blood or sputum. So first is cough, second is dyspnea. So this terms you have to write. Someone asked about how to write the prescription. So these are the things you have to remember. So the patient is coming and telling, I have the, whenever I'm talking, I have shortness of breath, breathing problem. So you have to write dyspnea. This is a symptom. And cough. This is a symptom. Wheezing sound. This is a symptom. Crowing sound. Okay, there are different types of sounds also, but here most important, wheezing sound. Coughing in the blood. Sputum in the blood. Sputum. Blood in sputum. Okay. Coughing. Blood in the cough. You can also call. And the sixth symptoms, that is kynosis. Okay. Kynosis. Here is there. So what is mean that the color of the skin will change. The color of the skin will change. Bluish color will, you can see from the pink or red or orange color too, you will see the skin of the color of the hands or the eyes or the tongue sometimes or the lips, it will become bluish. Okay, why this is happening? Because the deoxygenated blood is more, oxygenated blood is less. So here oxygen capacity is reduced. This is also one of the main symptom of lung disease. Okay, so kynosis, we can observe that color also, that thing also in the uh, respiratory system, blood in the sputum, crowing sound, wheezing sound, dyspnea, and cough. So these are the symptoms. Seventh system says symptom, very important. Chest pain. This is also due to the lung disease sometimes. Already we discussed this. Most of the chest pain, it is due to the gastric issues. Secondary, cardiovascular disease. Third thing, it is due to the lungs also, pulmonology or respiratory system. Okay. So here we have to differentiate. It may be to the lungs, it may be to the heart, it may be to the gastro, GIT. Okay. Three things will there. In the three things, most of the things are GIT. And the eighth one is clubbing of finger, clubbing of fingers. So this is also one of the symptoms. Means due to the lung disorder, the fingers become club, like swelling. We will see the image. Okay. So these are the 8 symptoms. So here we have the symptoms. Number 1 is cough. Symptom number 2 is shortness of breath. Okay. Symptom number 3 is wheezing sound, crowing sound. Okay. Blood in sputum. Okay. Next is we have chest pain, clubbing of fingers. Next is lungs abscess. Okay. And sometimes clubbing of fingers due to the lungs abscess, lung cancer, or bronchitis. Okay. So these are the pneumonia, bronchitis, asthma, emphysema. So sometimes, but most of the not there are the not causes, but in the lung cancer, lung abscess, bronchiectasis. So in these cases, we have these problems. So we talked about important complaints, important important things which represents the diseases of respiratory system. Okay, so let's see the image of two things: clubbing of fingers and kinosis, because this is very important. If you see that, you will easily understood. You will remember the clinical symptoms. What do we call this? Clinical symptoms, which will lead you to the uh, respiratory system disorders. So you can see that this is the symptom of kinosis. So you can see these are the bluish color fingertips. Okay, fingertips. This is also here the lips or something. Okay, in the face also you can see that. Okay, so you can see this image and the second image here. So this is, you can see that this is the normal fingers. You can see that these are the clubbed fingers. Okay, means the tip of the finger or phalanges will become bulb-like structure, bulb enlargement. We can see that. Okay, so this is clubbing. Okay, so these are the symptoms we have to understood. So now we'll talk about some things. Why the because every disease have this type of symptoms. If the diseases increases, okay, so the pattern of the disease will decide. So what type of symptoms the patient will have. Let's discuss some things regarding these symptoms. In which diseases we have this type of diseases. So first is cough. We will discuss all the 8 things. Cough. So we know that cough is an uh, one of the it is also one of the thing that which involve to remove the unwanted things from the lungs. Means it is a explosive movement. What is the explosive movement of air? What is cough? It is explosive. Explosive movement of air to remove the irritating from the body. And it's also sudden. We don't know when cough will come. Sometimes it will continuously, we will cough. Okay, here in the cough, we will observe two types of cough. One is dry cough or wet cough. So which type of cough is there? So we will indicate different type of diseases. Or we will also call in the wet, we have sputum, and the rough without sputum. Expectorant and non-expectorant. Expectorant means wet, non-expectorant means dry cough. So in the wet, we have mucus. We have the mucus, and other is we have uh, debris or any unwanted things which is present in the uh, mucus, sometimes cells also. Okay, it means that if the cough, the wet cough, it may be white first is initially the thing, and it may be yellow and milky color. White after white, it milky color. We have to see that, and dark yellow. Okay, dark yellow. Next is uh, blood which is mixed in the sputum. You can see the red in color, orange color, pink color. So this indicates there is a severe infection in the lungs, bacterial, viral, or fungal. Mostly yellowish color indicates the bacteria. Blood will also indicate the bacteria like TB or yellow, dark, milky, or in the smell in the lungs while coughing, while expelling the sputum, it indicates sometimes that it is fungal infection. Okay. So it will cause it. These are the irritants which are disturbing the bronchi, alveoli, primary, secondary, tertiary, any bronchi level, or mostly right side of the lung is affected initially, then left side of the lung. Sometimes we have the patient will have different habits like smoking. Okay, smoking also cause cough, and it is also irritating. Why? Because the smoking will damage the airways. If this is the bronchi, so these are the alveoli. So it will damage. We have the mucus already we studied in detail initially. So it will damage these things, this layer of the alveoli. Okay. So what will happen if this damage due to the smoking? Okay. What will represent? What type of color will represent? Yellowish. We can observe, or brownish or greenish. Sometimes greenish, sometimes brownish. Sputum. Okay. And if the clear, sticky type of sputum, what it will indicate? It indicates asthma, bronchial asthma. Okay. So this is the things. This is how we decide. And if the patient have, if you are checking the mucus membrane, mucus, whatever the mucus is you are sending to the lab, please check the eosinophil count in this membrane or in the blood level. So what are the tests we have to do? We will also discuss that. So it indicates that it is any asthma type indication, eosinophilia also. Eosinophil count is increased, WBC count increase. So it indicates asthma. Okay. So sometimes the cough will due to the some other things, and in the cough, the patient will have sputum mixed with blood. It means it is a serious disorder. We have to give the treatment immediately. So this is how we will talk about the cough, dry, wet cough. Wet cough have different type of sputum colors. That's how we'll indicate viral, fungal, or bacterial infection. Okay. This is the thing. So you have to remember. And second symptom is, what is the second symptom? Because these are the clinically very, very important. So you have to remember to, to reach the diagnosis, final diagnosis. Second is SOB, dyspnea. We know that dyspnea is lack of oxygen in the body. So in that, what will happen? The two to three things will happen. We have to remember that. Because cough and dyspnea is an initial symptoms whenever our respiratory system is involved. In the dyspnea, we have to see three things. We have to see three important things. One is breathing, respiratory rate. What is the respiratory rate? We have to see that. Okay. And second one is patient is taking breathing, but he is unable to take the breath into the lungs from the lungs to the bloodstream. We have suffocation. Okay, some suffocation means This is the innermost difficulty to breathe the air, suffocation. Okay, this is very important. This is the second thing you have to remember during. There are the other things also, but here we are understanding only discipline. Okay, suffocation will happen. Like someone is you tightly holded you, tightly roped you with the rope. Okay, so that how much some suddenly someone keep hand on the mouth, it will happen. Suddenly you have suffocation. Okay, and muscular effort in the discipline. If this is my if this is serious thing, we have to see that the muscular efforts we have taken, that the diaphragm or abdominal muscles, or we have the intercostal muscles, which all these are involved to take the breathing. Like, okay. So this is the one symptom. In the SOB, we have to see all those things. Respiratory rate, if more than 25, 26, it means tachypnea is there. Okay, means respiratory increases. Suffocation is there. So muscles involved. All these three things indicates a serious issue in the lungs, or else the bronchi or alveoli are damaged. We have to see the damage issue. Okay, so we will discuss in detail in coming classes. Okay, that discipline. Some two things I have to teach about here. Some person will experience once in a lifetime, or in mostly in old age, or like in COVID-19, the patients in this respiratory rate increases, suffocation. Okay, so what will happen here? Because the body, any due to the issue of the respiratory system, the body produce more carbon dioxide. Okay, and the oxygen is not properly getting into the body, so carbon dioxide increases. So means here in the brain, what will happen? The brain is also getting less amount of oxygen. So the respiratory centers in the brain activates. So you have to force to the lungs to take the oxygen, because the brain is not getting proper amount of oxygen. Okay, so we have to treat the lungs. Sometimes there is suffocation. There is something even or more than that. That is excretion, exertion. Sorry, exertion. This is also you have to ask. Exertion means while talking, the patient have shortness of breath. While standing, while walking, while climbing stairs. Okay, this all are indicates an issue in the lungs or in the heart, or lungs in the heart. So if the disease is more, even in rest also patient have exertion. Okay, like sitting position. Okay, this is very important symptoms. What are the other lung disorders we'll discuss in detail in coming classes. So here we understood about dyspnea. Next is third one is we have wheezing sound. We have wheezing sound. We have keep the stethoscope in our clinic to check the lung sounds. We have two types of lung sounds: when inhaling, when exhaling. When inhaling, when exhaling. So those lung sounds are very important. So what that means, whistle sound indicates there is an obstruction in the bronchi obstruction. So lungs, the the oxygen or carbon dioxide is going through this bronchi, the obstruction will cause whistle sound. The obstruction is causing whistle sounds. That's the reason wheezing sounds you can hear in the lungs or the airways. Any problem in the airways, it indicates the wheezing sounds. What type of problems we will discuss. Let's also listen the sound. We will listen. So other sound is we have croaking sound. Okay, crowing sound also. This is also indicates any blockage in the throat region, voice box, windpipe. Okay. Third symptom is whistling. After wheezing sound, we have stridor, that is crowing sound, or any tumor in the lungs, in abscess in the lungs, or any swelling in the upper airway. Okay, these are the things will happen. Next is hemoptysis. Hemoptysis means the blood in the sputum. It is indicates the infection, severe infections, tumor, cancer, or TB, smoking, or lung degeneration, or obstruction in the arteries, veins. Okay, blood pressure, pulmonary hypertension. Okay, these are the things which indicates in the blood hemostasis. Next is kynosis. The color of the face, hands will change. Okay, this is also indication of less amount of oxygen. This is the second stage of after SOB. The phase of SOB is continue. So what will happen? The patient will, you can see the less amount of oxygen is representing to the hands, legs. Okay, it also indicates the heart disease also. So we have to differentiate with the diagnosis. Okay, and chest pain, it is also due to the heart issues or lung issues. So we'll discuss like pleurisy and the pleura is affected. Okay, so this is the thing we have to remember. And the last thing is the chest pain only. Okay, so let's see the sounds. Okay, how the sounds will come. We see different types of wheezing sounds. So this is the sound, wheezing sound. Okay, I will also send the audio. Okay, you can listen many times to remember that sound. So this is all about in today's class. So we discuss the symptoms. What are the symptoms? Different types of symptoms related to the lung diseases, respiratory diseases. So anyone have any doubts? Kindly ask.